My name is Clint Cappiello. I'm one of the pediatric surgeons at Johns Hopkins Children's Center. I also have a practice at Howard County General Hospital. So operating on children is sort of the last general surgery field. I operate on children in the Howard County neonatal ICU who weigh 1 pound and children who have gallbladder disease that weigh 300 pounds. And so consideration that each child is not a little adult is sort of the dogma of pediatric surgery. That means specialized dosing of medication. Our instruments for an infant are maybe only a foot long and 3 millimeters, so they would fit on the inside of a standard Bic pen. Pain, duration, temperature regulation, postoperative management, fluids, antibiotics, everything is scaled to the patient's size and weight. That's the most important thing that we consider, how big they are and how mature their ability to metabolize those medications are. We also tailor our analgesia and our operative approach to the patient's size, previous operations, or other complicating factors. It runs the gambit. Parents want to know everything from, is this going to hurt? Have you done this before? How can a baby so small tolerate an operation? And so part of my job is counseling and reassurance. We do incredibly invasive operations on infants who are 1 day of age, and they do great because kids generally are tougher than adults. They don't remember any of this, and their physiology is quite resilient. They want to know, will my child be in pain? Yes, they had surgery. We're going to minimize that as much as we can, but I can't take it all away. What's recovery like? Depends on the surgery, it depends on the kid. A 5-year-old umbilical hernia repair is not going to sit still to recover for a month like an adult would. They're going to go to school the next day and jump around with their friends. So we try to counsel the parents that's normal, but they can do things to minimize complications. Constipation, coughing, straining. Don't pick your little brother up. Avoid playing contact sports. And if you can, try to minimize your aggressive activity and rough play for a few weeks. Surgery for children is, I like to say, parents never get to meet me on their best day. There's a lot of anxiety. Children, depending on their age or exposure to a hospital, may be terrified of having a needle, an IV, going to sleep. We generally reassure them that going to sleep is just taking a big breath and taking a nap. For younger children, we'll avoid putting an IV in until they're already in the operating room going to sleep. Most times a parent will accompany a child to the operating room to sort of ease some of that anxiety. And fortunately, the medication they get, they don't even usually remember going back to go to sleep. Postoperatively is somewhat confusing. They're waking up, unfamiliar environment, so we'll bring parents back basically as soon as it's safe to do so. Kids are going to be a little groggy right after the operation. It's a good time to video them because you'll have something to hold over them for later on. They won't make sense. They'll be kind of flailing around in bed, so we comfort them, make sure they have good pain medication, and then let them have something to eat or drink, usually something bland or just liquids. Nausea does happen. We do counsel parents and patients before the operation. If there's a family history of nausea or difficulty with anesthesia, we'll use medications to mitigate that in the postoperative period. I usually inform parents that I know this is not the best day of your life, particularly for emergencies, children who need an operation suddenly when they were otherwise going about their daily routine. I reassure them that we have pediatric nurses, pediatric anesthesiologists, and we do this operation, whichever it may be, regularly. We've dedicated our career and our training to taking care of just kids. So every precaution I would take to have my own child operated on, we do for your child.